Good morning, I'm Hannah Jane Dayaw, student nurse from High University of Science Technology. Today on this video is about demonstration on providing tracheostomy care. First for the goal, the patient exhibit a tracheostomy tube and side free from the drainage, secretion, and skin irritation or breakdown. For the equipment, check for bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit if available, and be sure to collect supplies listed that are not available in kit, or 2 sterile 4x4 inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing or pre-cut and soon surgical dressing, sterile basin, small sterile brush or pipe cleaner or disposable inner cannula, small brush, roll of twill tape, tracheostomy ties or tracheostomy holder, scissors, pulse oximeter, stethoscope, clean gloves, it should be 2 pairs, mask, goggles or face shield, hydrogen peroxide, PNS or sterile water. For the implementation, first, bring necessary equipment to the bedside stand or overbed table. 2. Perform hand hygiene and put on PPE if indicated. 3rd, identify the patient. 4th, close curtains around bed and close the door to the room if possible. 5. Determine the need for tracheostomy care. 6. Explain what you're going to do and what the reason to the patient even if the patient does not appear to be alert. 7. Adjust bed to comfortable working position, usually elbow height of the caregiver. Lower side rail closest to you. If the patient is conscious, place him or her in semi-Fowler's position. If patient is unconscious, place him or her in the lateral position facing you. Move to the overbed table close to your work area and raise the waist height. 8. Check for lung sounds. 9. Place the towel below the trachea site, covering the neck and chest of the client. 10. Put on face shield or goggles and mask. Suction tracheostomy if necessary. If tracheostomy has just been suctioned, remove soiled site dressing and discard before removal of gloves used to perform suctioning. 11. Prepare the basins and cleaning solutions. Mix sterile water or PNSS and H2O2 in one basin, 50-50. Be sure it will fill 0.5 inch of the basin. Then add another PNSS in another basin that will fill at least half inch. 12. Perform gloving, cleaning the tracheostomy. 13. Remove the oxygen source if one is present. Stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Then, press the tabs and release the lock. Gently remove the inner cannula and place it in first basin with PNSS and with H2O2 and let it submerge there for a few minutes. 14. Simultaneously, gently slide the tracheo pad or dressing downward and discard. Check for some exudates or drainage, skin breakdown, irritation, and inflammation. 15. Clean the inner cannula of the tracheo tube using the prepared PNSS with H2O2 and use brush to remove solidified or sticky mucus. Rinse using the second basin with PNSS only and discard gloves and put on another gloves if necessary. Dry the inner cannula using sterile gauze or pad and gently reinsert it back to the tracheostomy tube and be sure it is properly locked. 16. Dip cotton tip applicator or gauze sponge in cup or basin with sterile saline and clean stoma under faceplate and use each applicator or sponge only once, moving from stoma side outward. 17. Pat skin gently with dry 4x4 gauze sponge. 18. Slide commercially prepared tracheostomy dressing or prefolded non-cotton filled 4x4-inch dressing under the faceplate. 19. Check the fit of the tracheostomy collar, and you should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Reapply oxygen source if necessary. 20. Remove gloves, assist patient to a comfortable position, raise the bed rail, and place the bed in the lowest position. 21. Remove additional PPE if used. Perform hand hygiene. Then, for the documentation, 22. Reassess patient's respiratory status including respiratory rate, effort, oxygen saturation, and lung sounds.
Demo time.
provide tracheostomy care. Hope you like and enjoyed this video. Bye!